Hello, this is Aaron Shoemaker again, and I'm here with Melinda Mackey, who is our Ascension Medical Group Indiana Director of Quality, and we're going to talk about colon cancer screening today. Colon cancer screening is an important initiative that we are working on this year to improve the quality and care for our patients. It's also a STARP goal, so it's important to all of us as associates as well. So Melinda, what counts to satisfy colon cancer screening in the medical record?
So for calendar year 17, what we have are our available options within Athena that satisfy are the FIT test that is done annually. You have the Cologuard test, which is new to this year, and that has a 3-year look back. And then you have the gold standard colonoscopy that is good for 10 years if normal. Also, you have your traditional FlexSig for 5 years, and you also have your CT colograms.
We're really focusing on those first three.
The first three, really the best test is the one that the patient's willing to do based on risk. So that's really why we want to focus on those three, because of the ease and accessibility of those tests.
Great. What are we doing this year to really focus on improving rates?
So one is the scorecard. I know that we talked last week about the scorecard push, so that has some visibility in terms of performance month to month. We also want to make sure that the physicians understand that it's not all on them, that we have central support for providers and staff. So we have a central gap closure team that works at the state level that is actually auditing payer reports, as well as going back annually for those patients that have been identified in Athena as having that metric not satisfied. If it's not satisfied, they come through the chart, look for any existing evidence that could be used to satisfy that metric, and then they bring it over and classify it properly so that the physician gets credit.
Great. And we're also working on education around order sets.
Yes. So one of the things that we did was the Cologuard, because it was new for calendar year 17, it was one that was not already in the quick pick sets that the physicians were accustomed to. So we just added that. So all they would need to do is type in Cologuard, and they should be able to see that order today.
Good.
We've also created a shared decision tool that we're going to be sending out that will also review the options that the clinicians can provide what would be count for this metric for their patients.
Great. And I know we'll have an attachment for the shared decision making handout, and also we're going to have an attachment to help our providers know how to order the colonoscopy, correct?
That's a great point.
When we order it, we want to have it satisfy. So how does that happen?
Right. So for those patients that are high risk, or ones that we've identified that need that colonoscopy, we have a new way that we want the physicians to place the order within Athena. Instead of the colonoscopy referral process, we actually want them to order it through the colonoscopy procedure. And that will be routed the same way that the colonoscopy referral is, but it helps that result tie back and satisfy that metric to complete the loop and give you credit in Athena, which is the goal.
Great. So we'll be giving them information on how to order the test and have it be closed when we order it.
Yes.
We'll be giving them information on how to have conversations with their practice on and the staff discussing colonoscopy and colon cancer screening with the patients at the time of intake and things like that. And they can also use the scorecard to help understand their gaps.
Absolutely.
Thank you, Melinda. So this year we really want to focus on improving the quality and care for our patients regarding colorectal cancer screening. We've got lots of tools to help you with that. One of the best places you can learn about this is the symposium coming up on February 11th. So we'd love to see all of you there on February 11th. And we'll continue to give you updates on quality regularly.